euthanasia amounts to doing or not doing, something to intentionally bring about the patient's death, also known as assisted suicide. It is a form of suicide or even murder depending on the patient's level of involvement. Euthanasia is not the actual drug itself. Some of the actual lethal drugs included in the injection are sodium thiopental, pentobarbital, and pancuronium bromide. These are the three main drugs used for euthanasia. In order for a patient to receive euthanasia, a doctor must ensure that the patient has 6 months or less to live in order for them to receive the lethal drugs. The drugs are administered through a syringe with a legal amount of lethal drugs. The patient cannot receive more of the drug if needed. Euthanasia is currently legal in Oregon, Washington, Vermont, California, and Montana. Although in Oregon the law is highly restrictive, you must be near fatal death to be eligible to receive the drugs. Euthanasia is different in other countries. In the UK, it is legal to help somebody kill themselves under any circumstance. In the UK, assisted suicide is a 14-year sentence in prison. Dr. Ellen Webby, a doctor in Canada, has injected 40 people since June. She believes euthanasia will grow in the Netherlands and Belgium, which would make that about 5% of their deaths. More than 745 people have been euthanized in Canada since July 2016.
To end their life when they want to. And my job is, in that sense, to help them have a good life and good death, by their standards, not by mine, or anybody else's, but by their standards.
Some of the sicknesses that patients usually have when they receive euthanasia is a severe case of arthritis, different types of arthritis, terminal cancer and other types of cancer, ALS, and malignant lymphoma. Many doctors do not support euthanasia because their job is to save and help people and not have or help them die, while other doctors do not want their patients to suffer. Others think that terminally ill patients should be allowed to die with dignity instead of a long and painful death. Many doctors have said they'd oppose laws saying they'd go against their oath to save lives. Of the U.S. cancer doctors that were surveyed, 25% supported the use of physician-assisted suicide for a terminally ill patient with extreme pain, while 6.5% supported euthanasia. During their career, 10.8% of the doctors surveyed had participated in physician-assisted suicide and 3.7% had performed euthanasia. The cancer doctors who believed that received adequate training in end-of-life care and those who felt they had sufficient time to talk to dying patients about end-of-life care issues were less likely to perform euthanasia or physician-assisted suicide. In 1938, the Euthanasia Society of America was founded in New York, and their goal was to gain legal and social rights of vulnerable humans. Euthanasia lets the patient exercise the moral option to refuse extraordinary medical means and die a comfortable death. The goal is to not bring about death, it is to make sure the patient is in the most comfortable state during their vulnerable time. Euthanasia is a form of suicide or even murder depending on the patient's level of involvement. Unfortunately, when it comes to some cases with the sick and disabled, they feel like this is a definite suggestion. The bill used for assisted suicide rose from $1,000 to over $3,000 in February 2016. Many studies have found that assisted suicide is rarely used. Although it isn't used much, it's important because the number of legal physician-assisted suicide is growing slowly. 3 bills to legalize assisted suicide have been rejected in NSW. Another doctor stated, "Killing someone is not a procedure." Canadians believe they should have the right to die without further delay. People want to die, and we should provide the means. Nearly 70% of deaths in the U.S. occur in hospital, nursing homes, and hospice facilities. Thousands of patients, both verbally and in writing, request do not resuscitate. Many patients do not want to be hooked up to a respirator. Most families wouldn't want their house pet to suffer, so they feel as if, why should a human suffer? An effective referral does not foreshadow or guarantee an outcome. Doctors go back and forth about whether euthanasia should be legalized or not. Doctors have a right to freedom of consent. Doctors are not required to perform or assist in the provision of assisted suicide, and the law requires that the person's disorder has to be intractable.